What is allergic conjunctivitis? I'm Dr. Manan Shah. I'm an ENT allergist here at Winley Health. The conjunctiva is the name for the tissue that lines your inner eyelid and goes onto the eye. It's sort of the whites of your eye and then goes back down into your eyelids. When that area gets inflamed or irritated from contact with pollens or dust mite or cat or dog dander or whatever you're allergic to, that's what we call conjunctivitis. Itis means inflammation and conjunctivitis is inflammation of the conjunctiva. If you're having this, you can use allergy eye drops like Pataday, or you should work with an allergist to try to decrease your allergies either through immunotherapy or through other medications. Ultimately, if you have constant allergic conjunctivitis, you're going to want to rub and itch your eyes, and over time that can actually damage your eyes and your vision. If you'd like to learn more, please subscribe. What is allergic eczema? I'm Dr. Manan Shah. I'm an ENT allergist here at Winley Health. Allergic eczema or atopic dermatitis is a skin condition that happens, and it's usually associated with having allergies like to pollen or dust mite or cat and dog. Ultimately, what happens is your body has an allergic reaction, and that irritation can lead to scaly, itchy, irritated skin, and these cracks in the skin can then lead to infections and can lead to scaling or scarring and stuff like that. Ultimately, the easiest way to treat this is through frequent moisturization. This keeps the skin from getting dry and broken, trying to avoid itching. And then there are other things like avoiding long baths, because again, you don't want to wash away the natural oils of your skin. You want to keep your skin moisturized. You want to pat yourself dry instead of rubbing, because again, that can wipe down the oils. And then lastly, it's been shown that if you decrease your allergy triggers, you can avoid your allergic eczema. So if you'd like to learn more, please subscribe. How do you know if you're allergic to cats? I'm Dr. Manan Shah. I'm an ENT allergist here at Winley Health. If you think you might have a cat allergy, it's usually because you're having symptoms around the cat. So what'll happen is when the cat protein, FeLD1, is inhaled into your nose, or you breathe it in through your mouth, or it goes in your eyes, you'll start to have runny nose, watery eyes, sneezing, and even some throat issues. You might have itchy throat, and then if the cat licks you, you might even have hives on your skin. That's how you know you have a cat allergy. Now, the best way to confirm this is through doing either a skin prick test or an allergy blood test, which we offer here on our website. One of the things you can do if you have a cat allergy is try what's called immunotherapy. In immunotherapy, what happens is we expose your body to a small bit of what you're allergic to until over time it becomes desensitized. So we actually have a FeLD1 extract that we can utilize to try to desensitize you to cat allergies. I did it and it really helped me, and now I have less symptoms around cats. So if you'd like to learn more, please subscribe. Can allergies cause chest congestion? Absolutely. I'm Dr. Manan Shah. I'm an ENT allergist here at Winley. When you have bad allergies, what's happening is things are getting into your nose and irritating your nasal passageways. What then happens is some of the mucus will drip down the back of your throat, and it can cause chest congestion, chest colds, and irritation. If you have bad allergies, the easiest thing you can do is start by using a saltwater rinse, which can just rinse out some of the allergens from your nose. You can also take nasal topical steroids like Flonase or Nasonex, and then you can also use antihistamines. If these things aren't working, or if you're having constant allergies, you should work with an allergist to think about doing immunotherapy. If you'd like to learn more, please subscribe. How do you treat a mold allergy? I'm Dr. Manan Shah. I'm an ENT and allergist at Winley Health. As our climate is changing and the world is becoming more damp and humid, unfortunately, we're going to see more and more mold, and that's going to lead to more and more mold allergies. Mold is a known trigger for both allergies and asthma, and it's associated with a sinusitis called allergic fungal sinusitis. Ultimately, the best way to treat a mold allergy is through a thing called immunotherapy. In immunotherapy, what happens is we expose your body either orally or through shots to what you're allergic to until over time your body becomes desensitized. We have extracts for mold that can be used in shots, and they can be used for drops as well. If you'd like to learn more, please subscribe. Do humidifiers help with allergies? Well, allergies happen when your nose or your mouth or your eyes is exposed to something that you're allergic to, like pollen, dust, or mold, or cat dander or dog dander. What happens then is you get inflammation, and it leads to nasal congestion, runny nose, sneezing, watery eyes, and allergy symptoms. A humidifier can keep your nose from being dry, and that dryness is what allows the pollen to get stuck in there. And so if you can have mucus created, it'll catch the pollen and the mold or the dust, and then you'll be able to blow it out and you'll have less allergy symptoms. So that's why we will often tell patients to use a saltwater rinse, which is essentially humidifying the nose. And a humidifier in your room will also help decrease the dryness. So I think it's worth considering a humidifier if you feel like you have a very dry air environment and you're having allergies. The one caveat though is you have to be careful with a humidifier that it's clean, because humidifiers can also grow mold, and that is also an allergy trigger. So you just have to balance those two things out. If you'd like to learn more, please subscribe. Can you keep taking your antihistamines and medications during immunotherapy? Yes. During the first 3 to 6 months of immunotherapy, your body is still starting to learn how to become desensitized, and so it makes sense to keep taking your antihistamines and medications. But as you go on in therapy, we hope that you won't need those medications and that you'll start to have less allergy symptoms just naturally. That's sort of the goal of the immunotherapy. What is vasomotor rhinitis? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. Vasomotor rhinitis is a term for when your nose is just constantly running, and it might not be due to an external stimuli. So allergic rhinitis is when something like pollen or dust gets into your nose and your body is irritated and it creates mucus to wash those things out. That's called allergic rhinitis due to an allergen. But vasomotor rhinitis is when it's not an external trigger, but your nose just runs almost like you have an allergy, but you don't. I like to think of it as a malfunction of the nerve signal coming from the brain to the nose, and it's making too much mucus. So there are treatments like Atrovent or ipratropium bromide, and then azolastine that we can do to help those. And lastly, there's a treatment called the Clarifix or the Rhinair, where you essentially irritate the nerve that goes to these terminates, and you try to decrease the signal from the brain to the nose to create that mucus. These are surgeries that an ENT can do under local anesthesia at any local office. Anyways, if you'd like to learn more, please subscribe. What are classic allergy symptoms? The classic allergy symptoms are those that are mediated by a molecule called histamine. So when your body's exposed to an allergy trigger like pollen or dust or cat dander, what happens is it releases a molecule called histamine. Histamine causes your eyes to get runny or watery or itchy. It causes your nose to get runny or itchy or stuffed. And it even can cause like hives or itchy nose or sneezing and things like that. So by blocking histamine, you can stop your allergy symptoms. And what immunotherapy does is it decreases the amount of histamine your body releases. What are hypoallergenic cats? I'm Dr. Manan Shah. I'm an ENT and allergist here at Winley Health. Hypoallergenic cats are cats that are supposed to cause less cat allergies than other cats. So first, what causes a cat allergy? Well, there's a protein called FeLD1. That protein is found in the oil glands of cat's fur and also in their saliva. This is why if you have a cat allergy and it licks you, you can get a rash. So hypoallergenic cats are cats that are going to have less cat FeLD1 and they're going to cause less allergy symptoms. Some of the cats that are going to cause less allergy symptoms are the Siberian cat or the Burmese cat. But in general, most cats are going to cause allergy symptoms. Some of the things you can do to try to avoid cat allergy symptoms are getting your cat groomed frequently so the oils wash away. You can use an air purifier to try to bring some of the cat dander out of the air. You can try to keep the cat out of your bedroom, which is going to obviously decrease the amount of exposure you have. And lastly, you can try to have wood floors instead of carpets because the cat dander is going to get stuck in soft things like couches, carpets, and curtains. But if all this stuff doesn't work, the best answer is to try something called immunotherapy. The idea behind immunotherapy is an allergist works with you and exposes you to small doses of cat dander until over time your body gets desensitized. I actually did this myself because my wife loves cats and I had a bad cat allergy, and it significantly decreased my cat allergy symptoms. If you'd like to learn more, please subscribe. What causes eye allergies? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. When your eyes are exposed to things like pollen, dust mite, cat or dog, or anything you're allergic to, your body releases a molecule called histamine. Histamine is a vasodilator, meaning it makes your blood vessels wider, and it causes itchy eyes, runny nose, watery eyes, and sneezing. One of the worst things that happens with eye allergies is it makes you want to rub your eyes. But if you do that too much, you can actually damage your cornea. So if you have eye allergies, you can use eye drops like Pataday, or you should work with an allergist to consider doing something called immunotherapy, which will desensitize you. Ultimately, we worry that if you have constant eye allergies, you can get inflammation around your eyes. It can irritate your eyes and even cause vision issues. If you'd like to learn more, please subscribe. When should you see an allergist? I'm Dr. Manan Shah. I'm an ENT and allergist here at Winley Health. Allergists are physicians that specialize in treating things like allergies, essentially allergies to cats, dogs, mold, dust mite, tree, grass, weed, pollens, and then also food allergies. If you're having allergy symptoms like runny nose, sneezing, watery eyes, and you're having them all the time, it might be worth working with an allergist. Most people think that they just have to use antihistamines and nasal sprays forever, but they don't realize that you can actually do a thing called immunotherapy that slowly desensitizes you to what you're allergic to, so you don't have to take nasal sprays like Flonase and Benadryl or Claritin all the time. So if you'd like to learn more, please subscribe. Why is my nose itchy? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. When your nose is itchy, oftentimes it's due to exposure to allergens. So what happens is something you're allergic to gets into your nose, your body realizes it's not supposed to be there or thinks it's not supposed to be there and releases a molecule called histamine. Histamine is a molecule that's going to cause your blood vessels to dilate, but it also makes you itchy. And so it's going to want to make you itch your nose. When histamine is released in your skin, you can get a rash and you want to itch the skin, but ultimately that's why people take antihistamines like Benadryl or Claritin or Zyrtec to decrease the symptoms. If your nose is constantly itchy, you may want to try allergy medications like Claritin or Zyrtec or Xyzal. Ultimately, you may want to work with an allergist to try to decrease your exposure to allergens. Over time, this should allow your nose to stop being as itchy. If you'd like to learn more, please subscribe. 3 things to know before you get allergy shots. I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. The first thing you should know with allergy shots is they're not an immediate solution. When you start taking your allergy shots, you'll still have symptoms in the beginning, but the good news is most patients get really great long-term relief. The second thing you want to know before you start doing allergy shots is you should do them in a physician's office. While there are some practices that might let you do them at home, in general, it's safer to do them with a physician's office because there's a risk of a bad allergy reaction. And 3, you want to know that allergy shots are going to fix your allergies for long term. So most patients who finish their allergy shot course are going to have lifelong allergy relief. The other way you can do this is sublingual immunotherapy, which is a home allergy drop method. Thanks. How much does an allergy test cost? A lot of people want to know what an allergy test costs, and it can be confusing. There's so many variables to take into account. The first variable is what is the contract your doctor has with your insurance company? The second variable is how much does your particular insurance plan cover? And then you have to think about your deductible, because even if it covers X amount, you may have to hit your deductible before it covers it. So it can be really confusing. The good news is, in terms of ballparks, if you're getting a skin prick allergy test at a local physician's office, it's going to cost somewhere between $300 to $500. Sometimes it can be more, but in general, that's a good range. If you're getting allergy blood testing done at a local lab like Quest Labs or LabCorp, in general, it can be anywhere between $100 of a copay all the way up to $1,000, so it can be kind of expensive. And then there are finger prick home allergy tests, and those tend to be cheaper because your doctor can control the cost and can often sell them to you for an upfront cost. Ultimately, you want to work with a doctor you trust, and you want to try to figure out your allergies using both an allergy test, but also a consultation with a doctor to figure out if that test result actually makes sense with your allergy history. Why do antihistamines stop working? There's a couple of reasons that you might not think about for why your antihistamines just stop working. The first reason you might not think about is that your allergies just might be getting worse, or you might be getting new allergies. The second reason you might not think about is that due to climate change and warming, we seem to be seeing that pollen season is lasting longer and longer each year, so people are experiencing worse allergies. And the third reason that you really might not think about is that as you get older, your immune system changes and many patients start to experience worse and worse allergy reactions. The good news is if you work with a physician, you can often find a medication that will help your symptoms, and that way you can get relief. Does it feel like your allergies are getting worse every year? You might be right. It turns out that the things that cause seasonal allergies like plants and weeds respond to carbon dioxide. That's how plants grow. And interestingly, as we have more carbon dioxide in our atmosphere due to climate change, allergy seasons are getting longer, they're starting earlier, and many people are feeling like they're getting worse. So you're not crazy. Your allergies might just be getting worse. The good news is you can still treat your allergies using a technique called immunotherapy. This is where we expose you to a small dose of what you're allergic to until over time your body gets desensitized. The traditional method of this was allergy shots, but you can now do it under the tongue at home. If you'd like to learn more, we'd love to work with you. Thanks. Can allergies cause ear drainage? Yes. Your ears and your nose are connected by a tube called the eustachian tube. It comes back here at the back of your nose. So if your nose is irritated and swollen by allergies, what can happen is the eustachian tube can swell shut. This can lead to fluid and irritation and infections in your ear, and this can ultimately lead to ear drainage. Can allergies cause ear infections? The answer is yes. Your ears and your nose are actually connected by a tube that comes from the back of the nose called the eustachian tube. So when your nose is swollen and irritated from allergies, your eustachian tube can actually swell shut. What happens then is there's not a good ability for your ears to drain into your nose, and fluid and bacteria can back up. So this can cause ear pressure, ear pain, fullness, that feeling like you're in the mountains or an airplane, and it can also cause ear infections. Can allergies cause insomnia? Allergies can definitely affect your ability to sleep well, and here's why. When you go to sleep at night, you're supposed to breathe through your nose, but allergies can cause swelling and irritation inside your nose, which makes it more difficult for the air to flow through your nose, and you may end up breathing through your mouth and getting dry mouth, or your tongue can flop back and cause sleep apnea, and certainly allergies have been linked with sleep apnea. So ultimately, fixing your allergies can definitely improve your quality of sleep. If you'd like to learn more, please subscribe. Can allergies cause laryngitis? The answer is yes. When you have bad allergies, your nasal cavity gets swollen and your body creates mucus to try to wash away the allergens. Sometimes that mucus and drainage can drain down the back of your throat and hit your larynx or your voice box. This can irritate your voice box and cause spasm and swelling and cause you to lose your voice so you sound like this. By fixing your allergies, you can often improve your postnasal drip and your laryngitis symptoms as well. Can allergies cause nosebleeds? The short answer is yes. When you have bad environmental allergies, your nasal cavity is swollen and irritated, and sometimes you'll be rubbing it or blowing it, and what can happen is over time, the small blood vessels that are at the tip of your nose can rupture. When these blood vessels rupture, they're really close to the surface of the nasal mucosa, and you can get nosebleeds. So sometimes fixing your allergies or just getting your nose to be less swollen can actually improve your nosebleeds. One of the easiest ways to fix this though is using something called a nasal saline rinse, and this will just humidify your nose. Can seasonal allergies cause your lymph nodes to swell? The short answer is it's possible, but it's generally unlikely. So let's talk about this. Lymph nodes are part of your immune system, and they're up and down your neck and all throughout your body. When you get an infection or an immune response, your lymph nodes swell up as part of the immune response, and you'll feel this lump or bump in your neck. In general, allergies don't cause that to happen, and it's far more likely that the allergies cause swelling in your nose, and this led to a sinus infection or an upper respiratory tract infection, and that's actually what caused the lymph nodes to swell. If your lymph nodes are swollen, you should probably talk to one of your doctors. We'd love to work with you here at Winley Health, and if you'd like to learn more, please subscribe. Can seasonal allergies increase your heart rate? The short answer is yes. So in general, what happens is when people have allergies, they take antihistamines, and often these have decongestants in them. And these decongestants like Sudafed are actually stimulants, and they increase your heart rate. And so, in fact, there's an article in the Journal of Epidemiology that came out in 2016 in Canada where it showed that high levels of pollen led to more people having heart attacks. And they think it's because people were taking these decongestants, the stimulants increase the heart rate and maybe cause people to have more heart attacks. So this is why in general, when you have allergies, we don't want you to take decongestants all the time. We want you to try using other methods like immunotherapy or just antihistamines on their own or nasal sprays to try to fix your allergies. Can you be allergic to horses? The short answer is yes, you can. Just like you can be allergic to dogs and cats, you can actually be allergic to horses. Most people who have a horse allergy are going to have classic allergy symptoms like sneezing, runny nose, watery eyes, just like if you have a dog or cat allergy. The good news is you can actually treat your horse allergy. Just like you can treat other allergies, you can treat it using a thing called sublingual immunotherapy, which is where you expose your body to small doses of the horse allergy trigger, and over time, the majority of patients will get desensitized. Can you prevent allergies in young kids? According to the clinical research, early exposure to a number of allergens can decrease the risk of allergies being developed in your kids at a young age. So for example, there was an Israeli study where they actually noticed that if you give kids peanuts at a young age, it decreases their risk of developing a peanut allergy. We've also seen this to be true with dogs and cats, where having a dog and cat when your kid is young tends to decrease the risk of them having an allergy later in life. And lastly, there have been studies that show that children who grow up in rural areas or are exposed to more bacteria and dirt tend to have less allergies. So ultimately, there is some thought that exposing your kids to a lot of things when they're young can decrease their allergies. Lastly, you should know that if you expose your kids to allergy immunotherapy when they're young and treat their allergies, it tends to decrease the risk of asthma later in life. This has been shown in a number of clinical studies. So if your kid does have allergies, doing immunotherapy can actually prevent asthma later in life. Thanks so much. Do I need a referral to see an allergist? The short answer is it depends on your insurance. Some insurance companies require you to have a referral to see a specialist like an allergist, whereas others let you go directly to them. The good news is nowadays with companies like Winley, you can actually schedule a visit directly online with an allergist, and you can even do a free initial call with our team just to make sure we're a good fit for you. Most people know when they have allergies, so it's pretty easy to figure out whether you need to see one or not. If you'd like to learn more, we'd love to work with you. Thanks. Do allergy drops work? A lot of people want to know if allergy drops actually work, and the answer is yes. They've been studied extensively, and they have been shown to work really well for seasonal allergies and environmental allergies. In fact, in the Journal of Allergy, the big journal that allergists use, they've been shown to work just as well as allergy shots. The thing that you want to research if you want to learn about it is the Cochrane Review, and you can find links to all that on our website, winley.com, under the science. If you'd like to learn more, or if you're interested in sublingual immunotherapy, we'd love to work with you. Does immunotherapy actually work? The most commonly cited number for whether immunotherapy works is a 70 to 80% efficacy rate. And this is consistent with what I've seen in my clinical practice. In general, about 8 or 9 patients out of 10 are going to get really good results from immunotherapy, and maybe 1 or 2 patients might not. And so ultimately, I think the odds are really in your favor to try to fix your allergies. And if you work with a doctor you trust and they're focused on you, I think you have a really good chance of feeling better. Thanks. What causes ear pain? Let's talk about the ear anatomy first. The ear acts as a funnel. The sound goes down it, vibrates the eardrum, vibrates these little bones in here called the ossicles, and then the sound goes into the cochlea where it goes via nerve to your brain. So if you have an infection here in your ear, you can have pain. But usually if you have an infection in here, in the middle ear or in the outer ear, you're probably gonna have drainage, meaning stuff's gonna come out of your ear. More times, you actually have pain in this thing called the eustachian tube. The eustachian tube is a tube that connects your ears to the back of your nose. So if you have swelling and congestion in your nose, this tube called the eustachian tube is going to have issues. And it's going to feel like when you're going up on an airplane, or it's going to feel like when your ears are clogged and you feel a little dizzy, and you'll even feel like maybe you're having trouble hearing. Anyways, fixing your allergies or your sinus issues can actually improve your ear pain. And then if your ear pain is associated with drainage, it might be an ear infection. And lastly, sometimes your jaw joint, which is right in front of your ear, can get inflamed, and that can cause ear pain. Usually that's ear pain on both sides. If you want to learn more, please subscribe. What are the 4 types of allergy reactions? Scientists classify allergy reactions into 4 types of allergy reactions. But in general, when people are thinking about an allergy reaction, they're thinking about type 1 hypersensitivity or IgE-mediated allergy reactions. These are the types of allergy reactions where IgE releases histamine, and your body will have symptoms like asthma or allergic rhinitis, which is sneezing and runny nose and watery eyes, or allergic dermatitis, which is skin rashes. Types 2 and 3 are the types of allergy reactions that are associated with IgG or IgM. And what this means is patients will have diseases such as hemolytic anemia or lupus. And type 4 is cell-mediated hypersensitivity. And what that means is it's a delayed type. And in this type of reaction, patients, their cells will actually attack things. And so this is usually associated with things like rejection of an organ transplant, and sometimes it is associated with a metal or skin reaction. How can I get rid of my allergic rhinitis permanently? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. Allergic rhinitis happens when something gets in your nose and causes it to be irritated, and your nose runs and drips and gets congested. The way to fix allergic rhinitis permanently is if you have allergies and you fix the allergies using immunotherapy, it will improve or permanently fix your allergic rhinitis. If you have something called vasomotor rhinitis, we can also prescribe a medication that fixes it. If you'd like to learn more, please subscribe. How common is oral allergy syndrome? Oral allergy syndrome or pollen food allergy syndrome is not very common. Of the people who have allergies, which that is very common, only about 5 to 8% of those patients are going to have oral allergy syndrome. The interesting thing though is that some patients will have oral allergy syndrome symptoms and they don't even realize they have environmental allergies. So it might just be an underdiagnosed disease. And just so everyone's on the same page, oral allergy syndrome or pollen food allergy syndrome is when you eat certain uncooked fruits or raw vegetables or nuts and you have sort of like numbness or tingling or allergy responses inside your mouth. What's happening is you actually have a pollen allergy, and your pollen allergy is being triggered by certain fruits and vegetables that have similar proteins to those pollens. Unfortunately, the only way to treat it totally is to cook those fruits or vegetables so the protein changes or to avoid them. There have been studies that show that sublingual immunotherapy like allergy drops can actually improve your symptoms, and that's been shown in a lot of patients in my clinic, but there's also been some studies that don't show that. So ultimately, we think you should sit down with an allergist and try to figure out the best plan for you. How do decongestants work? Decongestants like Sudafed or Afrin are essentially chemical versions of epinephrine or adrenaline. And what they do is they make the blood vessels in your nose go from being wide to being small. What that means is there's less blood flow to the structures in your nose, and it shrinks them. So if there's any swelling in your nose from allergies or sinus infections, you're going to breathe better for the short term. But you can't use these molecules for the long term, because long term they can have bad side effects. Ultimately, it's better to try to fix the root cause of your nasal swelling, like fixing your sinusitis or fixing your allergies. How long do hives last from an allergic reaction? When your body's exposed to an allergy trigger, it releases a molecule called histamine. Histamine makes your blood vessels get bigger, and when this happens in your skin, it can actually cause swelling, or what we call a hive. Depending on the allergy trigger, your hive can last an hour, it can last a day, or even multiple days. The best over-the-counter treatments for hives are things like antihistamines like Claritin, Zyrtec, and Benadryl. But if you have severe hives, you should work with an allergist to try to figure out the best way to make them go away for good. How long does oral allergy syndrome last? In general, the symptoms of oral allergy syndrome are going to last about 5 to 10 minutes, but if you eat a lot of the food, the symptoms can last for a long time. And just so everyone understands, Oral allergy syndrome, or pollen food allergy syndrome, is a syndrome where you actually have a pollen allergy, but what's happening is when you eat certain foods like certain raw vegetables or raw fruits or nuts, your body starts to have an allergy reaction in your mouth. And so you'll feel numbness or tingling or irritation directly in your mouth. In general, the best way to avoid this is to either cook the vegetables or fruits or to avoid them. But certainly there have been studies that show that immunotherapy in the form of allergy drops has actually improved patients' allergy symptoms. What you want to do is talk to your specific doctor to make sure that's true, because there's also been studies that have shown the opposite. How do you build up immunity to cat allergies? A lot of people suffer from cat allergies, and the tough thing is, cats can be awesome, so sometimes people want to have them. The good news is you can use a technique called immunotherapy, where your body's exposed to small doses of cat dander until over time you become desensitized. The way we do this as doctors is we use an FDA-approved allergy extract for cat dander. Now, a lot of people ask, why can't I just live with my cat? And won't I then just get immune to it then? Unfortunately, we just don't seem to see that this is the case. What I think is happening is that when you live with a cat, you're getting varying doses of cat dander and you're getting high doses of cat dander. Whereas with immunotherapy, we start you at a really small dose and we slowly build you up until your body gets desensitized. Ultimately, I've seen a lot of patients that I've taken care of get better for their cat allergies, myself included. And if you'd like to learn more, please subscribe. If you think you have a dog allergy, that kind of stinks because most people love their pets and don't want to get rid of them. Also, a lot of people are scared to go in and get the shot allergy test where they stick you with needles. And so we can actually send you an allergy kit at home. You do a small prick, you send us your sample, and we can look at your blood response to see if you have a dog allergy. The good news is we can actually treat you for your dog allergy using a therapy called sublingual immunotherapy. What we do is we expose you to a small dose of dog allergen under your tongue every day for a long period of time, and the majority of patients will stop having dog allergy symptoms. I actually did this treatment myself for cats, and it worked really well for me. If you'd like to learn more, we'd love to work with you. Thanks. A lot of people have dog allergies, which stinks because you probably don't want to get rid of your dog. What's a natural method of getting rid of your dog allergy? You can take Benadryl or Claritin, but that stuff is kind of unnatural and you may not want to take it all the time. What you can do is retrain your immune system to realize that dogs aren't bad. And the way you do this is through essentially exposure therapy, but it has to be done with a physician who prescribe you a medication that's essentially a natural dog dander, and you take it under your tongue daily, and over time, your body gets desensitized. How do you get rid of your seasonal allergies? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. There's 3 ways to block seasonal allergies. The first way is to try to avoid what you're allergic to, but this can be hard when pollen's in the air. The second way is using over-the-counter medications like antihistamines and Flonase. And the third way is using immunotherapy, which is a method of exposing your body to small doses of what you're allergic to until over time you become desensitized. The nice thing about immunotherapy is it fixes your allergy problem for long term. If you'd like to learn more, please subscribe. What makes your tongue itchy? It turns out an itchy tongue is usually some sort of an allergic reaction. So it's usually you ate something like a food that you're allergic to, or you might have something called oral allergy syndrome. This is when you're allergic to pollens or trees, and what happens is the body mistakes food allergens from fruits or vegetables as if it's the pollen from these trees. And so you get an itchy tongue or a swollen lip. Either way, you can learn about oral allergy syndrome, or I have another video about it. Anyways, if you're getting a lot of itchy tongue, you might want to think about whether you have an allergy. You may want to think about getting allergy tested. Thanks so much. What causes nasal congestion? Let's talk about it. Inside your nose, there's a couple structures you need to know about. The first is called your septum. It divides your nose into a right and left nasal cavity. But the other structure is called your nasal turbinates. These actually hang out from the side, and when they're irritated, they get swollen. So if allergens come into your nose, they get swollen and they make your nose congested. And the reason is because it's literally just harder for air to flow into your nose and down your throat. So some of the things you can do is you can use topical nasal steroids like Flonase or Nasonex. You can also consider using things like antihistamines. And if you feel like you have allergies, you can get allergy tested and do something called allergy immunotherapy. If you'd like to learn more, please subscribe. Is it safe to use antihistamines every day? In general, most of the available over-the-counter antihistamines are safe for long-term use. There are some potential side effects, and there are some cases where long-term antihistamine use can worsen urinary retention or narrow-angle glaucoma. But I think one of the biggest risks is that patients start using these antihistamines every day and sometimes forget they're on them, and they can then interact with other medications that your physician could prescribe you. So it's really important to work with your physician when you're using any medication for a prolonged period of time. I think it's also important to know that there are therapies called immunotherapy, which can actually desensitize you to your allergy triggers. So hopefully you don't have to use as many antihistamines. If you'd like to learn more, we'd love to work with you. Thanks. What causes your throat to get scratchy? So a scratchy throat usually happens when something is irritating your throat, usually like an allergen or maybe a virus or cold. Basically what can happen is mucus from the back of your nose can drip down into your throat and cause your throat to get scratchy. Sometimes your tonsils get swollen, sometimes your throat gets irritated. Another cause could be that something is coming up from below and causing acid reflux. Either way, if you're having a scratchy throat, you may want to think about whether you're having heartburn or reflux, or if you're having allergies, you may want to consider getting allergy tested and doing allergy treatment. If you want to learn more, please subscribe. Do you have a scratchy throat and you're not sure why? Well, there's two main causes of things irritating your throat. The first cause is things like postnasal drip or sinusitis causing mucus to drip down the back of your throat and irritate your throat. The other cause is things coming from below, meaning like acid reflux or non-acid reflux coming from your stomach and irritating your throat. The allergies and sinusitis, you're going to have symptoms like nasal congestion and watery eyes and postnasal drip, and that is ultimately going to cause your throat to get irritated and you're going to clear your throat all the time. By treating your allergies, you can fix this. Things like acid reflux are going to be things like after you eat, you're going to feel like your throat gets worse. You might have a lump in your throat, and you might just feel like you always have to like clear your throat and your throat is hoarse. By fixing this cause, you can fix the throat issues. If you'd like to learn more, please subscribe. What causes shortness of breath? When you breathe in, air goes through your nose, it goes through your throat, and into your windpipe. There's a couple places where you can have shortness of breath. If you have a blockage at your larynx or your voice box, this can actually cause shortness of breath because it can literally prevent the air from getting in there. This is things like, swelling of your vocal cords, tumors, masses, bad, scary things. Thankfully, these are pretty rare and most people don't have them. The more common thing that people are going to have is once the air gets down the windpipe and into the lungs, you can have narrowing of your lungs. That can be something like asthma. That can also happen from smoking or COPD or lung issues. Either way, if you're having shortness of breath and it's consistent, you really should go see a doctor. Sometimes it might be allergy related, meaning that your allergies are triggering asthma and that's what's causing your shortness of breath. Either way, the most important thing is to have somebody listen to your lungs and figure out what's going on. If you want to learn more, please subscribe. What are the signs of hay fever? Hay fever is known medically as allergic rhinitis, and it's most often caused by an allergy trigger getting up into your nose, your mouth, or your eyes. What it does is it'll trigger an allergy response. So you'll get a runny nose, you'll get cough, you'll get postnasal drip, you might get fatigue, you might get sinus pain. The good news is a lot of these symptoms can be treated by your physician. What causes seasonal allergies? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. Seasonal allergies happen when your body has a reaction to pollen. So this can be from trees, grasses, or weeds. And what happens is your body releases histamine, which causes you to sneeze, have nasal congestion, and just feel terrible. The good news is you can treat this using over-the-counter antihistamines, topical nasal sprays, or immunotherapy. Immunotherapy is the only way to fix it for the long term. If you'd like to learn more, please subscribe. What is histamine? You've probably heard about antihistamines, especially in the context of allergies, but you may be wondering, what are histamines? Histamines are molecules that are released by your body when they're exposed to something you're allergic to, like pet dander, or pollen, or dust mite, or a food allergy. Histamine is released by special cells called mast cells, and what happens is histamine causes your blood vessels to go from being small to being big. This causes more blood to go to the area, so if it's in your nose, what happens is your nose gets congested, it makes more mucus, so your nose gets runny, it also makes you have a cough, and it even makes your nose itchy and your eyes itchy. So if there's an allergen in there, you'll kind of rub it out and get rid of it. In general, this is a protective response for your body, but what we found is that people's bodies overreact. And so you have a lot of symptoms for something that you know isn't dangerous, like pollen or pet dander. Ultimately, you can retrain your body to not release these histamines using immunotherapy. And lastly, there are some foods like fermented foods or red wine that have a lot of histamine in them. So people who are really sensitive to this can actually have histamine responses to foods. And rarely, there's a type of fish where if it's not prepared appropriately, you can actually have histamine toxicity. It's kind of gross, but the allergy to mice is usually from mouse urine. And this was initially discovered from people who are working in labs and realized they were having trouble around the mice that they were working on. But now we realize it can happen to anyone. You can have a mouse allergy in the same way you can have an allergy to dogs or cats. The symptoms of a mouse allergy are sneezing, watery eyes, runny nose, classic allergy symptoms, but they usually happen inside because that's most of the time where you're exposed to the mouse proteins. The good news is you can actually treat your mouse allergy using a therapy called sublingual immunotherapy. We can expose you to a small dose of what you're allergic to until over time your body gets desensitized. What is cedar fever? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. Cedar fever is an odd allergy reaction that happens during the winter. While most allergy reactions actually happen during the spring or fall, cedar or mountain cedar tends to pollinate in the winter. And so patients will in the middle of January or December experience like stuffy nose, runny nose, watery eyes, and oftentimes they'll mix it up with a cold or flu. The good news is if you have an allergy to mountain cedar, you can do immunotherapy to fix it long term. If you'd like to learn more, please subscribe. What is oral allergy syndrome? Oral allergy syndrome is a reaction that occurs in certain patients when they eat raw fruits or vegetables and they get itching or swelling around their lips, their tongue, or their throat. Essentially what happens is these patients have an environmental allergy, meaning that there's a pollen that triggers an allergy reaction. And their body mistakes proteins in the raw fruits or vegetables for that pollen. And so when they eat the fruit, their body thinks they're seeing the pollen and they have an allergy reaction. What's really interesting is if you cook those fruits and vegetables, the heat changes the proteins in those fruits and vegetables enough that typically your body then doesn't have that reaction. So patients with oral allergy syndrome can often cook their vegetables and fruits and don't have these symptoms. Some of the common triggers are bananas, kiwis, peaches, and apples. And one of the good things is that if you treat your allergy symptoms using immunotherapy, often it can decrease your oral allergy syndrome symptoms. The easiest way to naturally fix your allergies is to actually just retrain your immune system. You see, when you think about it, allergies are kind of a mistake by your immune system. It doesn't really make sense for your immune system to recognize pollen or tree pollen as something that's dangerous. But what happens is, for some reason, your immune system now thinks that's a bad thing. What we can do is expose your body naturally to small bits of tree pollen or ragweed pollen, and over time we can desensitize you. And that way you don't have to take medications, but your body feels better. Which doctors do allergy testing? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. In general, there's 3 kinds of doctors that will do allergy testing. Allergists and immunologists will do allergy testing, ENTs will also do allergy testing, and primary care doctors will also do allergy testing. All of them will focus on figuring out what triggers might be causing your symptoms. But the most important thing to think about is it's not about the testing, it's about figuring out which doctor is going to really understand how to take your test results and pair them with your symptoms and make sure they make sense. Because the test is not what we treat. We ultimately treat the combination of the test and your symptoms, and we try to focus on what makes sense for you. Why do I feel tired after an allergy reaction? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. When you have an allergy, it can cause swelling and congestion in your nose, and if that happens, it can make it hard for you to breathe at night when you're sleeping. What this means is patients who have an allergy reaction will get bad sleep, and the next day they'll feel tired and fatigued. If you'd like to learn more, please subscribe. Why do allergies make you cough? Allergies make you cough because you start dripping mucus down your throat and it irritates your voice box, and your body coughs to try to keep the mucus from going into your lungs. So what happens is when you are exposed to something you're allergic to, like dust, pollen, or dander, what happens is your body creates histamine, and histamine makes you make more mucus. That mucus then drips down from the back of your nose into your throat, and it can make you cough, and that's super annoying, especially nowadays when people think you have COVID. The good news is you can treat your allergies using a technique called immunotherapy, where we expose you to a small dose of what you're allergic to, and over time your body gets desensitized. Why do allergies make your throat sore? A lot of people feel like allergies make their throat sore, and that's true. What happens is when you're exposed to environmental allergens in your nose, it actually causes mucus production, and that mucus drips down your throat and irritates your throat. The easiest way to fix this is to treat your environmental allergies. There's a lot of ways of doing this, and there's a method called immunotherapy that can fix it long term. Why do allergy medications not work? A lot of my patients tell me that allergy medications stop working for them, or that they have to keep switching meds, or that they're immune to certain allergy meds. That's pretty complicated, but ultimately what I think is happening is different medications work differently for different patients, and sometimes your allergies are just getting worse and you need to switch it up. The good news is we have a lot of different tools in our toolbox as allergists, so we can try over-the-counter antihistamines, we can do nasal sprays, and we can do something called immunotherapy, which is where we give you small exposures to your allergy triggers, and over time your body gets desensitized. Ultimately, if you feel like your allergy medications aren't working, you may want to work with an allergist because we can probably get you feeling better. How are allergy drops or sublingual immunotherapy a more natural way of fixing your allergies? Sublingual immunotherapy or allergy drops seems like a little bit of a more natural way of fixing your allergies because instead of just taking pills and sprays to mask your symptoms, you actually expose your body to small doses of what you're allergic to until over time you become desensitized. This is a more natural way of fixing it because it lets your body fix the problem, and ultimately you can stop taking pills and sprays. How old do you have to be to take sublingual immunotherapy or allergy drops? The answer is 5 years old. We use sublingual immunotherapy in our clinical practice with a lot of young children because it's kind of hard to get them to take allergy shots weekly, and oftentimes their parents are a little too busy to do a weekly allergy shot at the physician's office. In general, sublingual immunotherapy, otherwise known as allergy drops or sublingual tablets, is indicated or safe for children 5 years old and older. If you'd like to learn more, we'd love to work with you. Thanks. What is allergic rhinitis? Allergic rhinitis is the medical term for when something gets into your nose and your body gets irritated and you create mucus to wash it out. Usually the way this is mediated is through histamine. So something gets in your nose, it binds to an antibody called IgE. IgE releases a molecule called histamine, and histamine causes your nose to get runny, sneezy, and watery, so things run. But if you have constant allergies, your nose is always going to be allergic and runny. So what you want to do is probably get allergy tested and try to use medications or immunotherapy to fix your allergic rhinitis so you're not always miserable. If you want to learn more, please subscribe. Are you tired of purple dark bags under your eyes and swelling? It might be due to allergies. So it turns out there's veins underneath your eyes that drain into your nose for the blood to leave and go back to your heart. But if your nose is getting swelling from allergies or sinus infections, what happens is these veins can't drain the blood as well. And so you start to get blood pooling underneath your eyes and it starts to look dark and purple and you get that puffy thing which we call allergic shiners. The easiest way to fix them is to actually fix your allergies and your sinus infections, either using antihistamines or nasal saline rinses or topical steroids or immunotherapy. What's the difference between sublingual allergy tablets and allergy drops? In the 1980s, allergists realized that they could take the same FDA-approved extracts that they were using for allergy shots and prescribe them for patients to take them under the tongue or orally, and they realized they could get the same benefits as allergy shots. This therapy came to be known as sublingual immunotherapy. There have been 2 large-scale, independent, evidence-based analyses that have proven the efficacy of allergy drops. Because of the success of allergy drops, in 2011, the FDA approved sublingual tablets. These tablets are good if you have a single main allergen. So if you have an allergy to dust, or just grass, or just weeds, these tablets work well. If you have an allergy to multiple things, your physician will typically prescribe you allergy drops where they will personalize your medication using a prescription of the extracts so that you can treat all of your allergies at once. Ultimately, the most important thing is to work with a practice that you trust to find the immunotherapy that works best for you. Are allergies giving you headaches? So it turns out when something comes into your nose and irritates your nasal tissue, it causes swelling. And you can get swelling in the sinuses here, and even here above your eyes. If you start getting swelling in those areas, you're going to feel like you're having a headache. But fixing your allergies using antihistamines or nasal steroids or immunotherapy can actually decrease the pressure that you're going to feel when you're getting these triggers. So if you start feeling like you get headaches every time the pollen's out, you might want to think about allergy testing and immunotherapy. 3 things to know about anaphylaxis. Anaphylaxis is a life-threatening reaction that happens when you're exposed to something you're allergic to, like a peanut if you have a peanut allergy, or a bee sting, or even allergy shots. So 1, anaphylaxis can happen anywhere between the immediate exposure or 30 minutes. That's why you have to be watched for 30 minutes after an allergy shot. 2, what are the symptoms of anaphylaxis? Well, it can be your throat starts closing, so you have trouble breathing. You can get hives and rashes over your skin. Your blood pressure can get low, and you can get dizziness. And 3, how do you treat anaphylaxis? You want to use an EpiPen. If you think you're having anaphylaxis, you want to pull the pin, put the orange side down, and inject it into your thigh. You also want to make sure you call 911 because anaphylaxis can actually come back even after the epinephrine wears off. If you think you've had anaphylaxis or you've had to go to the hospital for anaphylaxis, you should see an allergist or an ENT to start figuring out the best way to treat this in the future. Are allergies causing your anxiety? In general, the answer is no. So some people, if you're having allergies and your nose is getting congested, it might make you anxious because you feel like you can't breathe. But more likely, if you feel like your allergies and your anxiety are related, you might want to take a look at the medications you're taking. Because in general, the allergy medications like antihistamines and Zyrtec and Claritin are supposed to be sedatives, but in some people, Claritin and Zyrtec will actually make you more anxious. It can actually make you more excited. And so you might want to think about other ways of treating your allergies outside of taking those medications. There are things like immunotherapy that can fix this. Anyways, if you want to learn more, please subscribe. Are allergies hereditary? Yes, allergies are hereditary. There's been a number of studies that have shown that parents who have allergies are more likely to have children than allergies than parents who don't. So what that means is if you have allergies and you have kids and they're starting to have allergy symptoms, it's probably worth getting them checked. One of the good things is if your children have allergies and you start them on immunotherapy, it can often prevent them from developing worsening allergy symptoms like asthma and eczema. Are allergy shots worth it? The short answer is yes. Allergy shots are a type of allergy immunotherapy, and allergy immunotherapy has been shown in numerous studies to drastically reduce allergy symptoms and reduce the need for allergy medications on a day-to-day basis. There's 2 types of allergy immunotherapy. The traditional method is allergy shots, which require a weekly trip to the doctor's office, and then the more modern technique is sublingual immunotherapy, which can be done using medications under the tongue at home. Both types of methods have been shown to have significant benefit in patients with allergy symptoms, so it's definitely worth it. Are ear infections contagious? The short answer is yes. Most ear infections in kids and adults are actually viral, meaning a virus comes in from your nose, it causes swelling of your eustachian tube, and you get an infection between the eardrum and the ear. That infection, if you're not washing your hands or if you sneeze on someone, can also infect your loved ones. If it's bacterial, it's less likely because usually it's contained within the ear. But again, if you touch some of the mucus or the drainage that comes out of someone who's infected, you can absolutely get the infection. The easiest way to fix this is using antibiotics if it's bacterial, or just using supportive care if it's viral. Are sinus infections contagious? Yes. So most sinus infections are actually viral, meaning you catch a virus like a cold or something like that, it gets into your nose, it causes blockage of the drainage pathways that drain from your sinuses into your nose, and you start having pressure and pain and drainage. So if you're not washing your hands, or if someone touches one of the tissues that you're blowing into, they can absolutely get your sinus infection. Other sinus infections are bacterial, and that's when the bacteria causes an infection in your sinus. These are a little bit less contagious than viruses, but you can still pass them from people to people because, again, if someone touches your mucus or your tissues that have the bacteria, or you're not washing your hands, again, you can pass it on. The easiest way to treat this is to see an allergist or an ENT to try to fix your sinus infections, and if you have allergies, you can get allergy tests and do immunotherapy. Why is your nose always bloody? Do you feel like every time you blow your nose, you're getting blood on your tissue, or you're getting bad nosebleeds that are embarrassing and annoying? Well, listen in. It turns out right here, right when you get into the nose, there are a bunch of blood vessels that are really close to the skin surface. And so anything that irritates them is going to cause these blood vessels to get irritated, inflamed, and bleed. So what are the most common things? Well, one, it could be allergies. Anytime you're blowing your nose a lot or your nose is irritated and inflamed, the blood vessels get irritated and inflamed and you get nosebleeds. Two, it might be that you have sinusitis or you have some other type of nasal infection that's causing the nose to get inflamed and bleed. And three, it might just be dryness. So the easiest thing to do if you're getting a lot of nosebleeds is to start using something like a nasal saline rinse. Just by spraying this into your nose a couple times a day, it can decrease the amount of dryness and hopefully stop the bleeding. The second thing that you want to do is if you get a nosebleed, you want to hold pressure. And a lot of people will hold pressure up here, but you actually want to hold pressure down here. And you want to hold for like 10 minutes straight without letting go. Because some people will hold for a minute and then let go and the blood clot falls. So that's the other thing. And the third thing you can do is use something called Afrin, A-F-R-I-N. It's a decongestant, but remember, you can only use that for a couple days in a row, otherwise it can actually make your nose worse. If you'd like to learn more, please subscribe. Are allergies causing your body aches? Well, it turns out allergies can cause like a brain fog and generalized like pain, but it's more likely that your allergies are causing nasal congestion from swelling in your nose, and then you're just sleeping bad. And so if you have poor sleep from your allergies, you're going to end up breathing through your mouth, you're going to get poor quality sleep, and you won't get restful sleep, and so you'll end up having body aches and general just like discomfort and fatigue the next day. If you want to fix that, you can definitely consider getting allergy tested and working on your allergies, and generally that helps improve sleep and overall health. Thanks. Can allergies cause ear pain? Allergies can absolutely cause ear pain. And the reason is because your nose and your ears are actually connected by a tube called the eustachian tube. So in the back of your nose, there's a tube that connects from the back of the nose all the way up to the ears called the eustachian tube. And when it gets clogged, you have that pain that you get when you go up in an airplane or when you go up to the mountains. So if you have swelling in your nose from allergies, it can cause the eustachian tube to get swollen and irritated. And this can lead to ear pain. It can even lead to you feeling like your hearing is muffled or that you're even imbalanced or dizzy. The good news is if you fix your allergies, you can often improve your eustachian tube dysfunction. Can allergies make you feel tired? There's three main reasons why allergies can make you feel tired. The first reason is the allergies themselves can just make you feel awful. You can get brain fog, you can feel like you have to sneeze, you're congested, and a lot of times this just makes people want to go back to bed. The second reason is that allergies can actually affect your ability to sleep. So if your nose is congested and you're just like congested and sneezy, you're not going to get good sleep, and the next day you're also going to be tired. And the third reason that a lot of people don't think about is most of the time when you have environmental allergies, you're treating yourself with antihistamines like Zyrtec, Claritin, or Benadryl. And these can often be sedating for certain patients. So allergies can absolutely make you feel tired. The good news is you can often fix your allergies using a technique called immunotherapy. If you'd like to learn more about how to fix your allergies for good, please follow. Can I take 2 different allergy pills on the same day? In general, if you're thinking about taking 2 different allergy pills at the same time on the same day, you may want to talk to an allergist. This is because things like Claritin and Zyrtec, when you take them together, can actually have side effects that combine, so generally we wouldn't recommend it. It is okay to take 2 different types of medications at the same time. So for example, you could take Claritin and Sudafed since they have different mechanisms of action and it's generally safe. Another example would be taking something like Singulair and Zyrtec, since again, these don't have any interactions. The typical thing that I recommend is taking 2 different routes of medication. So maybe taking an allergy pill and a nasal spray, like a topical nasal steroid or something like saline rinses, or taking an eye drop and a pill. When you take medications through different routes, the chances of having an interaction are much less. In general, if you're taking a lot of medications though, you may want to try a technique called immunotherapy where you can improve your allergy symptoms permanently. Can children take allergy drops? Yes. In our clinical practice, we often use allergy drops for children because it's really hard to get kids to do a weekly allergy shot, and oftentimes parents are too busy to take their kids to the allergist's office every week. That's why we use what's called sublingual immunotherapy. It's a method of taking the same allergy shot extracts, but dosing them so that you can take them orally. There are also sublingual tablets that are FDA approved. In general, sublingual immunotherapy is indicated for kids 5 years old and older. If you'd like to learn more, we'd love to work with you. Thanks. Can seasonal allergies cause joint pain? It may seem strange, but a lot of patients with environmental allergies will report things like joint pain that are associated with their allergy symptoms. Now, there isn't a direct link between allergy symptoms and joint pain, but there can be some indirect reasons why this is associated. So when you have allergies, you can get nasal congestion and obstruction, and that can lead to inflammation, poor rest, and just overall fatigue. And sometimes this can manifest as joint pain or just an overall feeling of fatigue and feeling bad. The good news is typically when you improve your allergies through either treatment or immunotherapy, most of your other symptoms that are caused by your allergies will also decrease. Are your allergy medications causing weight gain? The short answer is possibly. There have been a number of studies that seem to link or associate the use of antihistamines with weight gain over prolonged periods of time. But it's always hard to know, what the mechanism is and whether this is going to happen to you. Ultimately, the good news is if you have bad allergy symptoms, you can use a technique called immunotherapy to safely decrease your allergy symptoms for long-term benefits. Do allergy shots cause fatigue? Sometimes patients ask me if allergy shots can cause fatigue. In general, allergy shots can cause local side effects like itching, redness, or irritation of the skin right after you get the shot, and rarely they can cause a scary side effect called anaphylaxis. They can also sometimes just make you feel a little bit blah or fatigued, like you've been exposed to your allergy. But in general, fatigue is not a common side effect. If you are having side effects though, you should talk to your allergist to see if they need to adjust your dosing or your shot schedule. Because in general, immunotherapy is supposed to make you feel better, not worse. If you'd like to learn more about allergies or allergy shots or allergy testing, please subscribe. Does allergy testing hurt? The short answer is, it depends on what kind of testing you choose. The traditional method of testing that's done in physicians' offices involves multiple needle sticks to see how your skin responds to different allergy triggers. For some patients, this can be uncomfortable because it involves a lot of needle sticks and itching and irritation of the skin. But you should always talk to your doctor about what's right for you, since there are also allergy blood tests that can be done at a local laboratory like Quest Labs or LabCorp, and there are also now finger prick dried blood spot tests which can involve just one single prick, which you can even do at home. Ultimately, the most important thing is to work with a doctor you trust to figure out the testing protocol that makes the most sense for you and your life. Can immunotherapy actually fix your cat allergies? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. According to the research, immunotherapy can actually fix your cat allergies for long term. The most recent study was in 2007 in the Journal of Allergy, and it showed that allergy drops actually cause patients to have significantly less allergy symptoms to cats. If you'd like to learn more, please subscribe. Why are your eyes always dry? Well, there's two common reasons. So if you feel like your eyes are always itchy, dry, and irritated, the first reason is that you might not be making enough tears. And the second most common reason is that the tears you're making are evaporating. So let's get into it. 1, why are you not making enough tears? It might be that you're getting older, or that you're taking medications like allergy medications and antihistamines or blood pressure medications that are making your eyes dry out. There's also autoimmune diseases like Sjogren's that attack your tear glands, and that might be making you not make enough tears. And then the second most common reason is that you are making tears, but they're evaporating, meaning your eye gets dried out even though you're making enough tears. The reason for that, again, might be allergies. It also could be medications like topical eye drops that are irritating your meibomian glands. So there are these things called the meibomian glands that make oil, and they help the tears not evaporate too fast. Either way, if you're feeling like your eyes are always dry, itchy, or irritated, you might want to see an eye doctor, or you might want to consider allergy testing. Thanks. What causes ear pain? So it turns out your ears are actually connected to your nose through a tube called the eustachian tube. This tube goes from inside your ear all the way to the back of your nose, and it's basically back here. So if you have swelling, either from allergies or sinusitis or cold, it can cause the swelling in your nose to cause swelling in your eustachian tube, and that leads to ear pain and pressure. Sometimes this also happens if you go up in altitude, like going up to the mountains, which is my favorite thing to do, or if you go up on a plane. Either way, one of the things you can do is take a nasal decongestant like Afrin or Sudafed right before you go up in the plane or before you go up to altitude, or if your ears are painful, and you can see if it decongests your nose, and that might actually improve the ear pain. If it keeps going, you may want to see an ENT like me. We can do things to your ears to try to improve your symptoms. If you want to learn more, please subscribe. What causes hives? When your body is exposed to something, either through breathing it in, or eating or drinking it, or having it touch your skin, there are cells called mast cells. These cells release histamine, and that histamine causes your skin to cause hives, essentially welts. And what happens is histamine causes your blood vessels to go from being small to being big, and that sends blood to the area and causes the swelling. Now, if the hives are really bad, you can try something like Zyrtec, Claritin, or antihistamines. That can make the hives go down. If the hives are also associated with throat closing or symptoms that are scary, you may want to take what's called an EpiPen. And if they keep happening, you might want to go see an allergist or get an allergy test. If you'd like to learn more, please subscribe. How are allergies and sinus disease related? A lot of patients who have bad allergies also suffer from chronic sinus infections, and people want to know why. Well, it turns out that the way the sinuses work is they drain into the nasal cavity. But if you have pollen or environmental allergies that are causing swelling in your nose, it can actually affect the way that the sinuses drain and even cause swelling that can cause things to get built up in the sinuses. What that means is you get more facial pressure and pain, and your allergies can actually be associated or trigger sinus infections. The good news is that allergies can be cured or fixed using a technique called immunotherapy, and sinus disease can also be fixed by ENTs like me using surgery. How do you build immunity to seasonal allergies? There's really only 3 ways that you can treat allergies. If you're allergic to something like cats and dogs, you can avoid it by, not being around the cat. But that can be hard for things like pollen and tree pollen and grass pollen. The other option is you can take antihistamines like Claritin, Zyrtec, or Allegra, or you can do nasal sprays to try to help avoid the symptoms. These will help you for about 6 to 8 hours, but they're not going to cause a permanent change. The only way to cause permanent relief for your allergies is through a technique called immunotherapy. Using immunotherapy, you expose your body to small doses of what you're allergic to until over time you become desensitized. There's 2 ways of doing immunotherapy. You can do weekly allergy shots, or you can do sublingual immunotherapy, which you can take under the tongue. Both methods are going to cause exposure until over time you become immune. How do saline rinses even work? One of the most common recommendations people get when they have trouble with their nose or sinuses or allergies is to use a saline rinse or a saline mist. But how do they even work? Well, it turns out when you're spraying saline or saltwater mist into your nose, you're literally just washing the mucus the allergens and the pollen out of your nose. What that means is it's not there irritating your nasal tissues, it's not going to cause as much swelling and irritation, and it works really well for sinus and allergy issues. Now, we use saline or salt water because the tissues in your body also have salt water, so you want to wash the tissues in your body with a similar fluid to what they already are being washed with. And lastly, one thing I always tell people is a lot of people will spray them directly up, they'll hit the top of the nose, and won't really do anything. You actually want to angle your saline rinse back because if you look, the nose actually goes back. How long does allergy testing take? Allergy testing takes different amounts of time depending on what kind of test you use. So if you do skin prick testing, it usually takes between an hour to 2 to go get your skin stuck 60 times at an office, and then we have to check in and follow up to see what the results are. If you want to do blood testing, it can take substantially less time. So you can go to a local lab like Quest Labs or LabCorp and have your blood drawn. That takes about the time it takes to drive there, park, sit down, get your blood drawn, and go home. And now there are actually convenient home allergy tests that allow you to take a finger prick and your blood sample can be analyzed using a lab by mailing away the card. Ultimately, the test isn't the most important part. The most important part is working with a doctor who's going to listen to you and understand your symptoms and make sure that your test results match up with what your symptoms are. Because that's what we want to treat. We treat the patient, not the test. Anyways, if you'd like to learn more about allergy testing or allergies, please subscribe. How do you get rid of a cat allergy naturally? One of the only ways to get rid of a cat allergy naturally is through a technique called immunotherapy. The idea is you expose your body to small doses of what you're allergic to until over time you become desensitized. This can be done in 2 different ways. The traditional method is through weekly allergy shots at an office, and the more modern technique is through sublingual immunotherapy, which is where you take it under the tongue at home. A lot of people ask, why doesn't this just happen by living with a cat? And I think in some situations it might, but in general, we've seen that unless you're doing immunotherapy, you get these varying doses of cat dander, and so it's really hard for the immune system to become retrained. Whereas when you take a standard dose every day under the tongue, over time, your body actually just starts learning and you have less symptoms. How do you use an EpiPen? This is an incredibly important skill that can actually help you save someone's life in an emergency. So I'm really happy that people are sharing, commenting, and liking on these kind of videos, because again, this can actually help you save your friend or family member's life in an emergency. So an EpiPen delivers adrenaline or epinephrine in an emergency. So if someone's having an allergy reaction to medication, food, or immunotherapy, by delivering an EpiPen, you can save their life. So let's get to it. So first things first, thankfully, they make it incredibly easy to use. They literally put the steps 1, 2, 3 on the EpiPen. So you pull the pen, you inject it into the lateral part of the thigh, and then you hold it there for 3 seconds. So let's go through it. First things first, blue to the sky, orange to the thigh. Blue to the sky, orange to the thigh. So you pull the pin, then you go ahead and you hold it. If you're going to put your thumb somewhere, put it here. Don't put it here because you'll get a needle in it. Put your thumb on the top, then you inject it into the lateral part of somebody's thigh. This is a trainer. So once you put it into their thigh, you're going to hold it there for 3 to 5 seconds. I would tell people just count to 5 because in an emergency, you're stressed, you're going to be counting fast. You hold it there for 5 seconds, make sure the adrenaline is delivered, and then do not throw the pen away because the emergency medical services are going to want to know how much adrenaline has been injected so they can use it for their medical plan. Okay? The other important thing is no matter what, as soon as you use an EpiPen, you should have someone else be calling 911. If you're in a situation where you think you need to use epinephrine, you need to call emergency services because again, epinephrine is going to delay a bad allergy reaction from happening, but it's not the definitive care. If someone needs an EpiPen, they need 911 to be called. Now, when should you use an EpiPen? Well, if someone you know is having an allergy reaction to food, peanuts, whatever, and they're having trouble breathing, if they feel like their throat is closing, if their color is going, if their blood pressure is dropping, anything that makes you worried, go ahead and use the EpiPen because you would rather be safe than sorry and call 911. Okay? Also, shout out to Faith Pancos for making these kind of videos. It's really exciting that people are learning how to use this and that this knowledge is being spread. If you'd like to learn more, please subscribe. How do you interpret your allergy skin test results? When you have an allergy skin test, your doctor is going to irritate your skin or inject your skin with substances that you might be allergic to, like ragweed or dust mite. They also irritate your skin with something called saline or salt water. What this does is it gives us a comparison. You shouldn't have a really big reaction to salt water. So in general, the easiest way to interpret your test results is to look at what did you have a big reaction or welt to and compare it to how big it was when you were just injected with saline. If you have a big reaction, there's a high likelihood that you probably have an allergy to that substance. But most importantly, it's important to understand that just because you reacted to a substance doesn't mean that you necessarily have an allergy to it. In general, you have to work with your allergist to make sure the symptoms make sense. So for example, you might have a big reaction to cat dander, but if you don't have any symptoms when you're around a cat, I wouldn't worry about having an allergy. Does that make sense? If you have any questions, please let us know. Is a humidifier good for allergies? When you have nasal allergies, what happens is pollen or irritants get into your nose and causes nasal swelling. Things like nasal saline rinses and humidifiers can certainly help because they can loosen up the mucus and allow you to blow some of those irritants out of your nose and also just get less exposure to the allergens. So that's why a lot of doctors are going to recommend a saltwater rinse or a humidifier. Ultimately, the key is to try to get rid of the allergy irritants so you don't have as many symptoms. But there's also immunotherapy that you can use to try to fix yourself and become less sensitive to those allergens. Why is nasal breathing important for weightlifting and exercise? Well, it turns out your nose has evolved to be the best instrument to get oxygen into your lungs, and you need that oxygen to give you strength and energy when you're exercising. Let's get into it. So when air goes into your nose, the first thing that happens is you have these nasal hairs. So don't clip them all. They actually keep bacteria and bugs from getting into your nose. The second thing is you have these things called nasal turbinates. These will humidify and warm the air so that it doesn't go into your lungs, because if cold air goes into your lungs, sometimes your lungs can actually close shut and that prevents oxygen from getting in optimally. You need that oxygen to get into your lungs to help your exercise and fitness actually be meaningful. And so again, if you have problems with breathing through your nose, you have allergies, you have a deviated nasal septum, it's probably worth figuring that out to make sure that you can perform the best and focus on your exercise and fitness plan. Thanks. Do you have nasal congestion, but you're not sure why? It turns out there's two main types of nasal congestion. The first type of nasal congestion is when you're always blocked. No matter what, it doesn't matter what time of year, your nose is always blocked up. That could be an anatomical reason, meaning the cartilage inside your nose could be bent. We call that a deviated nasal septum. Or you could have trouble breathing and these turbinates inside your nose could be swollen up and they can be blocking air. Rarely it can be something like nasal polyps or it could even be a mass. But most people have nasal congestion that comes and goes, meaning you have it and then like a couple days later your nose is open again and then it gets blocked off, or sometime in the spring it's always blocked. Most of the time that's what we call a functional problem, meaning that something is getting in your nose and causing swelling of the tissues. Oftentimes it's allergies, meaning an allergies to pollen, dust, dander, cats, dogs, something like that. It gets into your nose, it causes the tissue to swell, and it makes it so you have trouble for the air going through here and into your windpipe. By treating your allergies or by treating your sinusitis or whatever your cause is, you can actually make it so that you can breathe better. This is going to help you breathe better, sleep better, and exercise better. So fixing your nasal congestion is totally important because ultimately you don't really want to be breathing through your mouth. You want to be breathing through your nose. That's why we have it. If you want to learn more, please subscribe. Why is your nose always runny? Well, one, it might just be that you have allergies. That's the most common reason. Something in the environment like pollen or dust or mold is getting into your nose, irritating it, and your body's making mucus to have it wash out. Two, it might be that you have something called vasomotor rhinitis. This is when your body's making a signal that's going to your nose and it's causing too much mucus, but there's no reason for it. It's not like a pollen is coming in and irritating it. It's just you're having a neuropathic response. For that, you might want to try something like Atrovent or azolastine. And three, it might be that you have a viral or bacterial infection like sinusitis or a cold. And basically what's happening there is the inflammation from your body fighting off this viral or bacterial infection is causing you to make a lot of mucus, and usually you're going to have facial pain and pressure and congestion. The first thing you might want to try are things like nasal sprays just to try to wash the bacterial or allergens out, things like Flonase. And then if you keep having issues, you may want to get allergy tested and you might want to see an ENT. If you want to learn more, please subscribe. Spring's coming, so what's the most important allergy you have to think about? Well, it turns out the most common spring allergy is trees. So trees start to bloom in the spring and you'll start to see pollen coming off them. Sometimes you'll even see like a yellow film on your lawn furniture. All of that stuff can get up into your nose and it irritates you. It causes you to have a runny nose, stuffy nose, sneezing, and even facial pain and pressure. The easiest way to treat that is using a nasal saline rinse or nasal steroids or antihistamines. But if this doesn't work, you might want to consider something called immunotherapy, which is where you retrain your body to stop being allergic to these things. If you'd like to learn more, please subscribe. 8 types of allergies that you should know about. 1. Medication allergies. Some people have allergies to penicillin or other medications. 2. Food allergies. Some people have allergies to things like peanuts and shellfish or other foods. 3. Insect allergies. So you can get bitten by a bee or a mosquito, and some people have allergies to those. 4. You can have contact allergies. Things like latex or certain metals can irritate your skin when they're touching you. 5. Mold allergies. This is when mold in your basement or in your environment actually causes allergies, asthma, and even sinusitis. 6. Pet allergies. This is when you have allergies to dogs, cats, or even horses. 7. You can have pollen allergies. This is when you can have allergies to trees, grasses, or weeds like ragweed or cedar. And 8 is when you have dust mite allergies. This is when there are microscopic creatures that live in the bedding and soft cloth in your house, and it causes you to get nasal congestion throughout the day. Anyways, these are 8 types of different allergies that you might want to know about. Thanks. Are you having a lot of vertigo or dizziness? Why is that happening? Well, it turns out your balance system is a combination of your eyes, your joints, your ears, and your brain. So if you have a problem in any of those, you're going to have dizziness. So let's talk about it. With your joints, if you have a nerve issue like diabetes or hip replacement, or there's something that's causing the signal to not come from your body up to your brain appropriately, that can make you dizzy. From an eye perspective, if you haven't gotten your prescription updated recently, or you have bifocals and you're having issues looking up and down, or you have any sort of eye issue, again, that can make you dizzy. Generally, when I see it is when people have ear issues. So there are certain bones that can get dislocated in the ears. We call them crystals. And when that happens, you can get dizzy for short periods of time. But also if you have allergies or sinusitis, it can cause congestion in your ear, and that can cause what we call eustachian tube dysfunction, and many people experience dizziness with that. And lastly, your brain can also cause issues. So there are vestibular migraines or migraines that cause you to be dizzy. It's crazy because they don't always have headaches associated with them. People just feel dizzy for a couple hours at a time, and then it goes away. So if you'd like to learn more, please subscribe. What allergies should I be worrying about in the fall? Fall, unfortunately, can be a really bad allergy season for some people. And that's because it's the end of grass allergy season, and also there can be weed allergies. That's things like ragweed, mugwort, nettle, and sorrel. The problem is these things tend to bloom when fall comes around, and it can be dry and windy, and there can be a lot of pollen in the air. The good news is there's a lot of ways to fix your allergies, and you can use immunotherapy to actually cure your allergies in some ways. If you'd like to learn more, please reach out. What causes post-nasal drip? A lot of patients feel like they have this chronic post-nasal drip. And what that means is they feel like there's mucus or something irritating them dripping down the back of their throat. It can actually be 2 different things. Sometimes that mucus you feel in your throat could actually be coming up from below, and that could be a form of acid reflux or laryngopharyngeal reflux. But oftentimes, post-nasal drip is literally just that. It's mucus that's being produced in your nose that's dripping down the back of your throat and irritating you and driving you crazy. A lot of times, it's due to allergies from the environment, like dust, pollen, dog dander, but sometimes it can be due to other things like chronic sinusitis, and lastly, it could just be due to your body making too much mucus. The good news is is if it's allergies, you can often treat it, and same thing with sinuses. What does pollen look like? Pollen comes from seed plants, and it's what they use to germinate. And it typically looks like a yellow or white dust. So sometimes when you go out, it's on your lawn furniture, or you'll see it on the hood of your car in spring. The bad news is sometimes this pollen is so thin and small, you can't actually see it, but you're still breathing it in. Now the good news is there's a lot of treatments like immunotherapy that can help you fix your pollen allergies for good. What is pet dander? Pet dander is really just a mix of the dead skin cells of the animal. It's almost like dandruff. So in cats, the FeLD1 protein, which is the protein that causes allergy symptoms in a lot of patients, is actually often associated with the dander. And then in dogs, the CAN-F1 protein, which is also another protein that causes allergy symptoms to dog allergies, is also associated with the dander. Now the dander or dead skin cells are really light, so they can actually get suspended in the air for a long time and you can breathe them in. And then they're tiny, so they get stuck to your clothes, to your bedding, to your furniture, and they can cause allergy symptoms. The good news about pet dander is if you have allergies to your dog or your cat, you can actually use a technique called immunotherapy to retrain your immune system so that you stop responding to your allergy symptoms. What's causing your wheezing? Wheezing is a sound that you often hear in people's lungs. You shouldn't hear it up here, but you actually hear it in the lungs, and most of the time you need a stethoscope to hear it. Wheezing is a sound that happens when the airways in the lungs actually get narrowed. So it's the sound of the air going through a narrowed pipe, almost like when you kind of pull on a balloon and the balloon makes that squealing sound as you let the air out. That's what wheezing is, but in your lungs. And anything that affects your lungs can cause wheezing. So things like smoking, COPD, bronchitis, asthma, allergies, pneumonia, all that can cause wheezing. From my perspective, I mostly see it with allergies. And so for patients who have allergies that also trigger their asthma, we'll treat their allergies and we'll treat their asthma to try to decrease their wheezing. If you want to learn more, please subscribe. When does pollen season end? The bad news is pollen season can extend almost throughout the year. If you have tree allergies, it's usually in the spring. So you're talking, March, April, May, but sometimes it even goes into June. If you have grass allergies though, it can extend into June, July, and August through the summer. And unfortunately, some people even have weed allergies like ragweed. And then we're talking September, October, and even November. So the bad news is if you have pollen allergies, you can actually have pollen allergies almost throughout the entire year. The good news is if you have bad allergies, you can actually treat them using a technique called immunotherapy. Why can't I stop sneezing? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health, and I get asked this all the time. So typically, if you have allergies to something like dust or pollen or animal dander, when you breathe it into your nose, what's happening is your body is mistaking these harmless substances for something scary like a parasite or a bacteria. And what happens is it binds to cells in your immune system, and your immune system triggers a response that is a scared response. It's basically trying to get rid of these molecules. So the sneeze response is actually a way of getting those molecules back out of your nose. The good news is if you want to fix your allergies, there's techniques called immunotherapy that can help you fix your allergy symptoms for the long term. Why do my allergies get worse at night? A lot of people complain that their allergies tend to get worse at night when they go to bed. There's a couple reasons this can happen. The first and most obvious reason is that when you lie down, more blood rushes up to your head just because of gravity. And so what can happen is your tissues in your nose can swell up a little bit. So if you have some swelling from allergies already, at night when you're lying down and your nose is even a little bit more stuffy, you're going to feel it more. The other reason is at night the temperatures tend to be cooler, so pollen tends to settle more in your bedding and your bed sheets and things like that. And then the last reason is when patients have allergy symptoms that get worse at night, they may want to think about whether they have an allergy to dust mites, because dust mites are a type of year-round allergy symptom that tend to collect in your bedding and your pillowcases and bed sheets. Why does grass make you itch? A lot of people complain that when they sit on the grass, they'll get itchy or irritated. And a lot of times, it's simply because you have an allergy to grass. But it could also be that you have an allergy to another pollen and you're being exposed to it when you sit on the grass. Lastly, some people actually get little microscopic cuts on their skin, and that irritates their skin from grass. And then another rare cause is you could just be having a contact dermatitis to some of the chemicals that's used on the grass. In general, if you're having a grass allergy like sneezing, itching, watery eyes, or runny nose when you're around grass, you can use a technique called immunotherapy to improve your allergy symptoms. Can allergies cause your ears to feel full? Absolutely. So if you look at the ear, on the other side of the eardrum, there's actually a tube called the eustachian tube. And the eustachian tube connects to the back of your nose. And so if your nose gets swollen, then your eustachian tube gets swollen and your ear is going to feel full. And if that happens, you feel like you have pressure and pain in your ears. So one of the easiest ways to fix it is by using topical nasal steroids like Flonase, and the other way to fix it is by using allergy medications. Thanks. How do you interpret your allergy skin test results? So when you have an allergy skin test, what's happening is your physician is exposing your skin to a bunch of potential allergy triggers like trees, grass, weeds, animal dander. And we want to see how your skin responds. In general, if your skin responds with a big bump or hive, which we call the wheal, or if it gets very red, which we call the flare, it means you might have an allergy to that trigger. But we want to ensure that it's not just that your skin is overly sensitive. So we use two controls. Are any dogs truly hypoallergenic? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. And unfortunately, the current evidence does not support that any dog is 100% hypoallergenic. In fact, the studies that have been carried out show that most dogs exhibit about the same levels of CAN F1, which is the dog allergen that most people respond to. So what this means is that while some people may respond differently to different dogs, if you have a dog allergy, the only way to truly retrain your immune system to stop being allergic to your dog is through a therapy called immunotherapy. If you have any questions or you'd like to learn more, please subscribe. How does an at-home allergy test work? Most at-home allergy tests use a technique called dried blood spot testing. And what happens is you prick your finger with a small lancet and you apply your blood drops to a sample card. This sample card then preserves the sample so it can be tested by a lab later on. This technique initially gained popularity for testing newborns because it was a way of getting a test sample without having to take a lot of blood, and this was in the 1960s. Recently, the technology has now been adopted to test for IgE, which is the antibody associated with allergies. And thanks to CLIA certification, we know this type of testing is clinically valid. How do you cure your cat allergies without having to do allergy shots? So for years, the only way that you could get rid of your cat allergy was through either getting rid of your cat or doing allergy shots. But in the 1980s, in the United Kingdom, scientists realized that they could give you the same FDA-approved allergy extract, but if you took it by mouth, using a drop, instead of doing a weekly shot, if you took it daily, you could actually achieve the same effects as the weekly shot. And it actually ended up being safer. They also found that this method worked just as well for dog allergies, for dust, and pollen. Can immunotherapy actually fix your cat allergies? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. According to the research, immunotherapy can actually fix your cat allergies for long term. The most recent study was in 2007 in the Journal of Allergy, and it showed that allergy drops actually cause patients to have significantly less allergy symptoms to cats. If you'd like to learn more, please subscribe. Do allergy shots hurt? Allergy shots, or subcutaneous immunotherapy, are a really good way of fixing your allergies for the long term. Most patients are able to tolerate them without any issues, but some patients don't like needles, and some patients will experience a local side effect, and rarely patients will have a systemic side effect. The good news is if you're someone who doesn't like needles, you can take something called sublingual immunotherapy, which is a method of taking those same medications by mouth, and that helps you avoid the needles. What are the two most common reasons for feeling like there's something stuck in your throat? Well, the first thing is if there's allergies or sinus infections dripping down the back of your throat, it can drip and cause irritation. The second thing is a reflux, so like heartburn. And if acid is coming up and irritating your throat, it'll bother you and make you feel like there's something stuck in there. The way you treat allergies is by allergy medications or immunotherapy. The way you treat reflux is by anti-reflux medications like omeprazole or famotidine, which are over the counter. Thanks so much. How common is anaphylaxis with immunotherapy? Anaphylaxis is a life-threatening allergy reaction that happens when you start to have trouble breathing, or you feel like you're going to pass out, or you have wheezing. Thankfully, it's pretty rare with immunotherapy. Now, for allergy shots, the risk of anaphylaxis is thought to be 1 in 25 million injections, so it's pretty rare. With sublingual immunotherapy or oral immunotherapy, it's thought to be 1 in 100 million, so incredibly rare, and this is why we let you do it at home. Thankfully, no one has ever died from sublingual immunotherapy to date. Ultimately, you should work with your physician to pick the best type of immunotherapy for you and your allergies. How do you get rid of your allergies for good? I'm Dr. Manan Shah with Winley Health. The only clinically proven way to get rid of your allergies is through a technique called immunotherapy. The way this works is your physician prescribes you a small dose of exactly what you're allergic to, and over time, as those doses escalate, your body becomes tolerant. At Winley, we do this using sublingual immunotherapy, which is a method of taking medications by mouth at home, and over time, your body stops responding to your allergy triggers. If you'd like to learn more, reach out. How do you take allergy drops? I'm Dr. Manan Shah with Winley Health. Allergy drops are really easy to take. You want to leave your vial somewhere where you're going to see it every day so you're reminded to be consistent. Then what you want to do is just take your appropriate prescribed amount of drops underneath your tongue and leave it there for about 1 to 2 minutes so it has time to absorb and interact with your immune cells. Then you can just swallow it. Most of the time, I tell my patients, take your drops and then either do your shaving or your combing or whatever you need to do in your morning routine, and about 2 minutes later, you swallow and you're all done. Thanks so much. How long does it take before allergy drops work? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. Allergy drops are a form of immunotherapy, which is a method of changing your immune system for long-term allergy relief. But they don't work overnight. Some patients will notice benefits as early as 4 weeks, but most patients will start to notice benefits somewhere between 4 weeks and 6 months. You really want to work with your doctor to find the best dosing and protocol for you. If you have any questions, please let me know. How long do seasonal allergies tend to last? I'm Dr. Manan Shah. I'm an ENT with Winley. Seasonal allergies tend to occur due to allergies to pollen from trees, grasses, or weeds. And so this allergy symptoms last as long as those things are pollinating. So for trees, that tends to be for about 2 or 3 months in the spring. For grasses, that tends to be for about 2 or 3 months in the summer. And for weeds, it tends to be in the fall. And so what happens is the pollen from these trees, grasses, or weeds gets into your nasal cavity, it irritates the tissue and causes inflammation, and your body responds by releasing histamine, which is what causes all of your allergy symptoms like runny nose, sneezing, itching, watery eyes. Usually when the first frost hits, your allergy symptoms should decrease because the pollen tends to go away. If you'd like to learn more, please subscribe. How much are allergy shots? Immunotherapy is a great way of fixing your allergies for long term. And 2 of the most common methods of doing this are allergy shots or sublingual allergy drops or tablets. In terms of the cost for allergy shots, most patients require a weekly visit to the doctor's office, or at some point in their therapy, they can do a monthly visit. In general, most patients have a $22 to $25 copay for their health insurance, and so this is about the price you'd want to expect to pay for a weekly or monthly allergy shot. And in general, most patients are on therapy for between 3 to 5 years, and that's just the amount of time it requires to get that long-term allergy relief. How safe are allergy drops? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. Allergy drops, when taken under the supervision of a board-certified physician, are incredibly safe. In fact, the research shows they're probably safer than allergy shots. The risk of anaphylaxis, which is a life-threatening reaction with allergy drops, has been calculated to be about 1 in 100 million or 1 in a billion, depending on which research study you see. That means you're incredibly safe when you're taking your allergy drops, but it still is really important that you do it under the supervision of a board-certified physician. If you'd like to learn more, please subscribe. How do you get rid of a cat allergy? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. The only clinically proven method to decrease your allergy symptoms from cats is through a treatment protocol called immunotherapy. The way this works is our doctors prescribe you a medication called allergy drops, which you take under the tongue daily. Over time, this exposes your body to the feline D1 protein, and over time, your body becomes tolerant. In my physical practice, I've treated a ton of patients using this treatment protocol, and many can now actually have cats. And clinical studies also show that allergy drops are effective at decreasing cat allergy symptoms. On a personal note, I actually had a cat allergy and I treated myself and I did everything right, and I've noted a really substantial benefit in my symptoms around cats. If you have any questions, please let me know. How do you relieve sinus pressure? I'm Dr. Manan Shah. I'm an ENT with Winley. Sinus pressure happens when the inside linings of your sinus cavities, which are in your face, here and here, get irritated or inflamed. The easiest way to relieve it at home is to try some over-the-counter things like Sudafed or topical nasal steroids like Flonase and Nasonex, or use saline rinses to help wash the irritants out. If this goes on for greater than 10 days or you're having symptoms of fever or purulence or just really getting sick, it's always worth checking in with your physician. If you'd like to learn more, subscribe. What allergens are blooming in the fall? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. If you're someone who starts sneezing or having runny nose or watery eyes every September, October, or fall, you may want to get tested for weed allergies. So ragweed is the most common weed allergy that blooms in the fall, but there's a lot of other ones like mugwort and nettle and marsh elder that can also cause weed allergies. Unfortunately, these are common across the entire United States, and even more unfortunately, as the temperatures across the earth rise, weeds will tend to bloom more and will have a longer blooming season. So if you're really bothered by this, please reach out. We'd love to help you. Thanks. What are allergy shots? I'm Dr. Manan Shah with Winley Health, and I'm an ENT and an allergist. Allergy shots are otherwise known as subcutaneous immunotherapy, and they're a method of using frequent injections to expose your immune system to small doses of what you're allergic to until over time you become desensitized. For patients that don't want to do it using the injection route, there are oral medications that you can take at home. If you'd like to learn more, please subscribe. What are the sinuses? I'm Dr. Manan Shah. I'm an ENT. I'm going to talk to you guys a little bit about what the sinuses are. So inside your nose, if your nose is like a hallway, there are actually rooms off of the hallway called the sinuses. These sinuses drain into the nose, and sometimes irritants like allergens or pollen or dust or bacteria can get inside the sinuses and swell them up. And that leads to pain and pressure in your head and your cheeks. The way we treat it is through antibiotics, surgery, and avoidance of things that cause it, like avoidance of your allergies. Thanks so much. What do antihistamines do? I'm Dr. Manan Shah with Winley Health. I'm an ENT and an allergist. When your body is exposed to one of your allergy triggers, you release a molecule called histamine. Histamine is a vasodilator, meaning it makes your blood vessels get bigger. This leads to more blood flow to the area, and it helps your body create more mucus to wash the allergy trigger out. It helps your eyes tear to also wash the allergy trigger out, and it helps you sneeze or itch to try to rub or blow the allergy trigger out. An antihistamine is a medication that blocks histamine from being released. This improves your allergy symptoms for the duration of the time that the antihistamine is in your body. It's not a long-term solution, but they're a great allergy medication for short-term relief. If you'd like to learn more, please subscribe. What is allergic asthma? Allergic asthma is the medical name for what we call asthma that is triggered by allergies that are usually environmental, like pollen or pet dander or dust. What happens is when your body sees these triggers, instead of realizing that they're just benign things like pollen or dust, it thinks it's a pathogen, and it releases a molecule called IgE. And IgE makes your airways go from being big to small, and so this makes it hard for you to breathe, and you have coughing and wheezing and shortness of breath. 15 to 20 million Americans suffer from allergic asthma, but thankfully, if you treat your asthma and your allergies with immunotherapy, in general, your allergic asthma attacks will decrease. What is allergic rhinitis? I'm Dr. Manan Shah with Winley Health. I'm an ENT. Allergic rhinitis is the medical term for inflammation that happens inside your nose from allergens like dust, dander, or pollen. The best way to treat this is to try to avoid it if you can, so if it's a pet, stay away from it. Or the second way is using over-the-counter allergy medications like antihistamines or nasal saline rinses or topical nasal steroids. And the last way is to train your immune system using immunotherapy to stop reacting. If you'd like to learn more, subscribe. What is anaphylaxis? I'm Dr. Manan Shah with Winley Health. Anaphylaxis is a severe allergy reaction that happens when your body is exposed to something that it really is worried about or scared about. What can happen is you feel like your throat is closing, your heart can start to pound, your blood pressure can change, and overall it can be life-threatening and scary. If you think you're having anaphylaxis, what you want to do is use an epinephrine autoinjector and inject it into your thigh. The good news is a lot of allergies can be treated using immunotherapy, and you should work with an allergist if you think that's something that might happen to you. Thanks. What is immunotherapy? I'm Dr. Manan Shah with Winley Health. Today I'm going to be talking about what immunotherapy is. So allergy medications like Claritin or Zyrtec, they'll work for a few hours, but as soon as they're out of your system, your allergy symptoms come back. Immunotherapy is the only scientifically proven method of changing your immune system for long-term allergy relief. The way we do this is we get you allergy tested, and once your physician identifies your specific allergy triggers, we give you small doses of exactly what you're allergic to over a prolonged period of time. Over time, what happens is your body actually becomes desensitized, so even when you stop taking the immunotherapy, you don't have symptoms. If you'd like to learn more, we'd love to work with you at Winley Health. Thanks. What is septal perforation? I'm Dr. Manan Shah. I'm an ENT. So inside your nose, there's a piece of cartilage that divides your nose into a right and left nasal cavity. If you look at it from the side view, it looks like this little piece of cartilage here, and above it and below it is bone. This cartilage is floppy, and so sometimes you can actually get a hole that connects the right and the left nose. A lot of times this can be due to drug use like cocaine, it can be due to picking your nose and trauma, and it can also be due to just getting hit. Ultimately, the best way to fix it is surgery, but it can lead to crusting and congestion and nosebleeds. Thanks so much. What is sinusitis? I'm Dr. Manan Shah. I'm an ENT with Winley. Sinusitis is the medical term for inflammation of your sinus cavities. But what are the sinuses? Well, I like to think of the nose as a hallway, so air can flow down this hallway and into your lungs. But off of this hallway are rooms, and you can see them here. So you actually have sinuses in your cheeks, you have sinuses in your forehead, you have some between your eyes, and you have some deep in the back of your head, which you can see here. When the tissue inside of these rooms or these sinuses gets inflamed, we call it sinusitis. And what patients experience is they'll feel pain and pressure. They'll sometimes feel like their nose is stuffy and clogged. They'll get drainage, and sometimes they'll just feel overall sick. There's a lot of ways to treat it, and we always recommend if you think you have sinusitis, you should be checked out by a doctor. If you have any questions, please let us know. What is the best over-the-counter antihistamine? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. The best antihistamine depends on what you need. So the fastest acting antihistamine is cetirizine, otherwise known as Zyrtec. That's going to get into your body within 15 to 20 minutes and start working, but it can make you somewhat drowsy. So the least sedating antihistamine is fexofenadine, otherwise known as Allegra, and that one is going to keep you from feeling drowsy and foggy. So it really depends on what you want. I tell my patients to try Claritin, Allegra, and Zyrtec and figure out which one works best for your body. Thanks. Hey, I'm Dr. Manan Shah. I'm here to talk about inferior turbinate hypertrophy. So let's talk about what makes your nose stuffy periodically, anatomically. So inside your nose, there are these structures called your turbinates. They come from the outside of the nose and they hang in. And you can see them here, sort of pointing in from the nose. So when you breathe, those turbinates are there to help your nose warm the air. But sometimes those turbinates get hypertrophied, meaning they get bigger due to things like allergies or environmental irritants. And when they get bigger, there's less airflow. So how do we treat this? Well, the first thing we can always do is treat your allergies. We can use over-the-counter antihistamines. We can use immunotherapy like allergy drops or allergy tablets to decrease them and prevent the cause. But from a surgical perspective, what we'll sometimes do is we'll sometimes actually go into your nose with the camera and we'll put a little device inside the turbinate and shrink the turbinates down. By doing that, you're literally just creating more space inside the nose. What's an allergy? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. Our bodies have an immune system that is there to fend off things that are dangerous like bacteria, viruses, and parasites. Sometimes your body overreacts to things that are not scary like pollen or animal dander and treats it as if it's a foreign invader like bacteria or viruses. When this happens, we call it an allergy. A great example is if you're exposed to pollen from a plant. That isn't a foreign invader, but your body treats it like that. So what it does is it tries to get it to wash out by making your nose runny. It tries to get you to blow it out by making you sneeze. And sometimes it'll try to get you to cry it out by making your eyes watery. You and I know that the pollen isn't dangerous, but your body has mistaken it for something that's scary. The best way to fix this is immunotherapy or using allergy medications. If you'd like to learn more, please subscribe. What's the difference between sublingual immunotherapy, known as allergy drops or allergy tablets, and allergy shots? I'm Dr. Manan Shah. I'm an ENT and allergist at Winley Health. So immunotherapy is the only way that you can change your immune system for long-term allergy relief. And there's two ways of doing this. The traditional method was allergy shots, which is where you came to my office and you got a weekly injection. Allergy shots work great for things like environmental allergens and also bee stings and venoms. But about 30 years ago, they discovered another technology called sublingual immunotherapy, which is where you take the allergen under your mouth. This is great because you can do it at home, you don't need any doctor's visits, and you don't need any weekly shots. Some of the benefits of sublingual immunotherapy is that they appear to be safer in clinical trials, they've been shown in research to work just as well as allergy shots, and they can be done at home. Ultimately, what you want to do is work with your doctor to figure out what works best for your life and pick that therapy. If you'd like to learn more, let me know. What's the easiest way to start treating your allergies? I'm Dr. Manan Shah. I'm an ENT and allergist at Winley Health. The first thing I usually tell patients is to try some of the conservative therapies. The best ones of these are the second generation antihistamines like Claritin, Zyrtec, Allegra, and you can use the generics of these. These are going to be better than Benadryl, which is going to make you pretty drowsy. Sometimes patients will forget to use the nasal sprays that they have available to them, and these are like Flonase and Nasonex. These are also going to work really well. And then you may want to use a saltwater rinse or mist just to get a little bit of the allergens out. If these don't work, you may want to talk to your doctor about prescription allergy medications like azolastine or montelukast. And lastly, if your allergies are really bothering you, you may want to just get allergy tested and consider immunotherapy. If you have any questions, we'd love to work with you. Thanks. Why do allergies make you sneeze? Well, it turns out when you have an allergy, it's because your body is mistaking something like pollen or pet dander for something dangerous like a virus or bacteria. And so what happens is if you get an allergen inside your nose by breathing it in, your body releases histamine, which is a chemical that causes you to sneeze and get a runny nose to try to get that thing out because it thinks that thing is bad. If you'd like to learn more, please subscribe. Why do allergies cause brain fog? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. There's two reasons why allergies cause that brain fog feeling. The first reason is that when an allergen goes in your nose and irritates it, it causes release of something called histamine. Histamine is a chronic inflammatory molecule that's just going to make you feel foggy and bad. But the second reason that not everyone realizes is when the allergens go into your nose, they cause swelling inside your nose. And what that means is the next night when you're trying to sleep, you're not going to get good airflow, you're basically going to get bad sleep, and the next day, you're going to have trouble concentrating and feeling good. So if you'd like to learn more about allergies, please subscribe, and we'd love to try to help you fix your allergies with immunotherapy, which is a method that fixes your allergies for long term. Thanks so much. Why do my eyes water? I'm Dr. Manan Shah with Winley Health. I'm an ENT and an allergist. Inside your eye, on the lateral side, there's a gland called the lacrimal gland. This gland produces tears, and tears help wash bacteria and dirt and other pathogens out of your eyes. When you have an allergy, your body mistakes something like pollen or animal dander for something scary like bacteria. And so your body creates tears to try to wash those things away. And this is irritating and annoying. One of the best ways to stop this from happening is using antihistamines, either oral like Claritin or Zyrtec, or using antihistamine eye drops. If you'd like to learn more, please subscribe. How do you get rid of your cat allergy without having to get rid of your cat? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. The only clinically proven way of getting rid of a cat or dog allergy is through immunotherapy. What this means is you take an FDA-approved extract and you either inject it weekly into your arm or you can take it orally as allergy drops. Over time, as you continue to expose your body to small doses of that cat or dog dander, your body becomes desensitized. If you'd like to learn more, please subscribe. How long after you start immunotherapy do you have to wait before you can get a cat or a dog? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. Unfortunately, the answer to this question varies. It really depends on how severe your allergies are. But in general, I tell patients that you can wait about 2 to 3 months before you can test out whether you're responding to cats or dogs after you've started your allergy drops or your allergy shots. If you'd like to learn more, please subscribe. What kind of nasal spray should you be using? I'm Dr. Manan Shah with Winley Health. So if you're having allergy symptoms and it's bothering you in your nose and you're having stuffy nose, runny nose, sneezing, a nasal spray is something you probably want to consider. We generally think of 5 types of nasal sprays. The most common one that you might have heard of is just a nasal saline rinse. This is literally just salt water, and you can sometimes have a mist or you can have a neti pot. And the idea behind this is you literally are just washing the allergens out of your nose. So if you're breathing in pollen, a saltwater rinse like a saline rinse is going to get it out of your nose. It's going to decrease the amount of irritants in your nose. What are antihistamines? I'm Dr. Manan Shah. I'm an ENT and allergist with Winley Health. In terms of allergies, when your body's exposed to an allergy trigger, it releases a molecule called histamine. Histamine causes the symptoms of allergies like runny nose and watery eyes. So antihistamines block the release of histamine and fix your allergy symptoms, at least for the time that you're using them. The most commonly known antihistamine is Benadryl. But in general, we recommend people use second-generation antihistamines like Claritin, Zyrtec, or Allegra, since these medications are less sedating. If you'd like to learn more, please subscribe.